Good afternoon, everyone. My name is Mike Wolf from the North Dakota Association of Counties and the County Employer Group. First of all, I'd like to thank you very much for attending today's training. I know people have busy schedules, but this is part of our mandatory training through workforce safety and insurance and our safety program with them. So there'll be a little refresher on our claims management program and our drug-free workplace program, but always a good reminder of reporting procedures for you. So we'll get started today with our claims management portion. We always like to tell employees when you're covered under workforce safety and insurance or workers' compensation. And it's basically anytime you're in the course of your employment. Um, you're not covered if you leave your work for lunch or other personal reasons. So if you go out on a walk for your coffee break and you tripped and fell somewhere, you would not be covered. Or if you left for a personal reason to go run an errand, you would not be covered as well. If you're commuting to and from work, that is not covered as well, unless there are some exceptions to that, unless you were driving a county vehicle or you are getting paid mileage for some reason to come back and forth to work. And sometimes different board members do get that. So we'll move along today with our incidents and injuries in the workplace. Incidents are basically anytime you have some type of an injury or an accident, but it's not bad enough that you need to go see a doctor. So you could be walking down the stairs, walking down the hall, you could trip, you could slip, not necessarily fall and catch yourself and twist your back or your knee and say, you know what, I feel a pain in my back or my knee, but it's not bad enough that I need to go seek medical attention. We need to record that with workforce safety and insurance. We need to report it so that we can document for you that something has happened to you in the workplace. Plus, it's very important for us to know as the employer that something has happened to you in the workplace, because maybe we might have to make some accommodations for you depending upon what your job duties are, especially if there's lifting or driving involved with that. So we're talking about minor cuts, bumps, bruises, those type of things. And generally we file those incident reports, and probably 95 or more percent of the time, those never turn into a situation where you need to go see a doctor, because they're not that severe in nature. But we do need to document those with workforce safety and insurance, because if in 1 week or 2 weeks from now, you come back to your employer and you say, you know, 2 weeks ago, I was by myself, I slipped and I tripped and I hurt my back and I thought it would be okay, but it's not. And now I want to go see a doctor. First of all, your employer is going to be very skeptical that this happened at work. And even a bigger skeptic is going to be workforce safety and insurance, because after all, Workforce Safety and Insurance is an insurance company. And what do you think one of the first things any insurance company does when a claim comes into their office? They look for a way to deny that, correct? And so we don't want to put you in a position where your employer or your insurance company is going to wonder whether that injury actually happened at work or not. So we want to make sure that we document that. We have to document that incident or injury within 24 hours of the occurrence. And it's a very simple process depending upon your county. First of all, you're definitely going to contact your supervisor and your risk manager. They file that online. It only takes a couple minutes, and we've documented that for you. And with today's technology of email, phone, and texting, there's no reason why we can't get that documented for you within 24 hours. Now, we have a lot of situation with bloodborne pathogen exposures, especially in our social service and law enforcement areas. And those are incidents that we really want to document for you, because at some point in time in the future, you're diagnosed with a bloodborne pathogen disease. We're going to want to know, did that happen at work or did that happen away from work? And if we don't document those bloodborne pathogen exposures, workers' comp will go back and they'll look at your work history and they'll say, well, this person's worked for 5 years for the county and there's no incidents filed as far as bloodborne pathogen exposure. So how could this possibly be a work-related situation? They might say, well, maybe they got a bloodborne pathogen from grabbing a grocery cart handle. There were still live antibodies on that, and then they touched their ears, eyes, nose, mouth, and contracted it that way. Just because you had a bloodborne pathogen exposure doesn't mean you need to run right to the doctor, right? So if you had some blood or saliva get on your skin, but there's no open wound areas for that, we would definitely want to file an incident, but we wouldn't need to go see a doctor necessarily because it didn't get into a open wound area or ears, eyes, nose, or mouth. But we definitely do want to document that. Now, if you do get saliva or blood into a open area, your ears, eyes, nose, mouth, an open wound area, then we definitely would want to go to the doctor so that we could get a baseline blood test to determine if that incident actually caused you to contract a bloodborne pathogen. So we're talking about reporting injuries and incidents to your immediate supervisor and your risk manager. And depending upon the process in your county, between one of those two people, they will document that incident and injury for you. And we always tell people nothing's too small to report. Even that cut finger on the previous slide, that seems pretty minimal, right? But we've had situations where county employees cut themselves, especially in the road department where it could happen frequently. People don't take care of that, and then an infection sets in. We had an employee in a road department cut his finger, thought it was going to be okay, didn't really take care of it, didn't report it to anybody, because we have a lot of county employees that work by themselves throughout the course of the day, and there aren't always witnesses to accidents that occur in the workplace. So he didn't tell anybody about it. A week later, he had an infection in his finger, came back to the supervisor and risk manager and said, I want to file a workers' comp claim. I cut my finger last week at work. Well, Workforce Safety and Insurance denied that because they said they didn't report an incident, didn't report it to anyone else. And so that could have happened anywhere. How did they know that happened on the job? So here we had a legitimate workplace injury denied by Workforce Safety and Insurance because it wasn't filed properly and that initial incident report wasn't filed. Plus, we might want to make some accommodations to you if you had an incident and you twisted your back. We want to make sure that you're not going to injure yourself further during the course of your recovery process as well. So we always like to mention about social service employees. Social service areas can get a little complicated for people. We try to simplify this process as much as we can. If you're just a regular social service employee, you continue to follow the reporting procedures for the county that you're working out of, okay? So we just want to make sure that you're doing that. So we might have a situation looking at maybe the Rough Rider North social service zone. Okay, the zone head county is Billings County. So of course, anybody in Billings County would file a claim there or an incident if they were injured. But the other counties in that zone are Stark, Dunn, Golden Valley, and Hettinger, for example. So that person that got hurt in any of those counties, they would report to their supervisor in that county and the risk manager in that county to take care of the filing process. Now, as time has gone on, the social service areas have developed these specialty programs, and it's a little different situation where maybe the zone base is in Trail County, but this specialty program employee works out of Cass County. They're just renting an office in Cass County to do this. So those employees have been instructed that you need to report your injuries and incidents to the immediate supervisor, and then in this case, they would report it back to the Trail County risk manager. This can get kind of complicated, but the thing we want you to remember is ultimately for social service employees, no matter what you're doing, contacting your supervisor first can be the best guidance we can give you, because from there, they should know what to do. They should be able to contact a risk manager, or they will be filing that or injury report for you with Workforce Safety and Insurance. So just keep that in mind. And that really goes for any employee. If you forget what to do, always contact your supervisor, and that would be the first start to the reporting process. We want to make sure that these injuries and incidents get reported within 24 hours of their occurrence. if we don't file these injuries or incidents within 24 hours of occurrence, Workforce Safety and Insurance is going to fine your county up to $350. Okay, plus again, we mentioned they're going to question the validity of the claim too, right? They don't know if there's delayed reporting whether that actually happened at work. And again, with today's technology, there's no reason why we can't report injuries and incidents within 24 hours. Now we have situations where employees do shift work on weekends, maybe after hours sometimes. And so if we have a situation for somebody in the sheriff's department, social services, the road department that gets called in to plow snow on a Saturday, and that happens after 5 o'clock on a Friday and before 8 o'clock on Monday or 8 o'clock on Tuesday if there's a state holiday on Monday, we have until then to report that injury or injury online with Workforce Safety and Insurance. However, if you're injured over the course of the weekend, you still need to contact your supervisor and your risk manager immediately, because we may need to determine what we need to do for corrective action so that you don't hurt yourself further if it was an incident, for example. If you did go see the doctor, then we can't even let you come back to the work for the rest of that weekend shift until we get a doctor's report to see whether that doctor's placed you under work restrictions. And so we want to make sure that we know and understand those work restrictions before we let you come back to work to, again, make sure you don't injure yourself any further. We also have to complete an accident investigation within 4 working days of the injury. And if we don't do that, that's another basis for Workforce Safety and Insurance to impose a $350 fine. It depends upon your county. In most counties, the supervisor in the department where the injury occurred is responsible for filing that accident investigation. It's all done online, a very easy process, step-by-step process. In some counties, the risk manager does the accident investigation, but that's up to the supervisor and risk manager to determine that that gets done in a timely fashion. Now, depending upon the nature and severity of that injury, that accident investigation could certainly take longer than 4 days, and we will work with the counties on that, and so will Workforce Safety and Insurance, just to make sure that it's eventually turned in. We'll talk a little bit about the Designated Medical Provider Program. The Designated Medical Provider Program is a program through Workforce Safety and Insurance where the county, the employer, designates medical providers that employees must go see for their initial workplace accident treatment. And the thing is with this program, if you don't go to a designated medical provider for your initial treatment, it's a basis for workers' comp to deny your claim. So it's very critical that you know who your designated medical providers are and that you go to them for your initial treatment. Now, if there's referrals or emergency care, that's not part of this program. If you went to the emergency room for an injury and they referred you to another doctor, a specialist, that would be fine. If you had to get emergency care and you had to be taken by ambulance somewhere outside of your provider network, then that doesn't fall under this program either. We're making sure that you're getting the best possible care as quickly as possible. Now, even though the employer has designated a medical provider or providers, it doesn't mean that you can't add additional designated medical providers to your form. Okay, if you do add or change designated medical providers, you must do that prior to being injured at work. Okay, so there can be more than one DMP by your employer or by you adding some. And generally, designated medical providers are your medical doctors, clinics, hospitals, maybe eye doctors, maybe dentists, chiropractors especially, and new under the workers' comp laws now, physical therapists can be identified as a designated medical provider. So here's the designated medical provider form. This is the workers' comp form. Your form may look a little different if your county has adjusted it, but this is a form that you sign off every year at some point in time. Generally, most counties are having you sign off on this form this time of year, saying that you understand and been informed about the Designated Medical Provider Program and the Drug-Free Workplace programs and policies. And so you would look at this form, and on the top of this form, the county may list a clinic and a hospital, for example. You look at that and you say, that's just fine. I go to both of those places, I'm covered. But you might look at that and say, I go to a different clinic, I go to a different hospital. Oh, wait a minute, the county hasn't designated a chiropractor, and I see a chiropractor. Because a lot of counties don't designate a chiropractor because most of the time there's just too many in each county to designate just one or two. So on the lower half of that form, now you can put your chiropractor in as a designated medical provider if you've had chiropractic care in the past and you think it's beneficial. But if you don't list your chiropractor and you're injured at work, you cannot go see your designated medical provider for your initial treatment. You'd have to go to a medical doctor. And what do you think the chances of a medical doctor referring you back to a chiropractor are? Probably zero, right? And so that's why it's important that you would have your chiropractor on this form so that that would give you an option. It doesn't mean you'd have to go to the chiropractor, right? If you cut your finger, you don't go to the chiropractor, but you go to the medical provider. But if you hurt your back, then you may go to the chiropractor for your initial treatment. And then that chiropractor may refer you on to someone else. So just know that you have options to do that. Not many counties put a dentist or an eye doctor on there because from our experience, we've seen that's all emergency care. If you get something in your eye that you know need to go see an ophthalmologist, or you chip a tooth and you need to go see a dentist, that's emergency care. It doesn't make sense to go to a medical doctor who's just going to refer you over anyway. So we've not had any issues in those emergency situations. And you can add designated medical providers anytime you want throughout the course of the year. It doesn't mean that the day you sign this form means that you're locked in for the whole next year. You can come back 1, 3, 5, 7 months later and say, I'd like to add another designated medical provider to this form, and you can certainly do that. So a very critical part of our training that you know and understand who your designated medical provider are. And if you have any questions about this program, you can certainly contact us, or your risk manager in your county has been trained extensively on this part of our program. So not talking about a little bit about the doctor's office visits. Every time you go to the doctor, we need to get back what's called a C3 form. It's a workers' comp form. It's a capability assessment report. Some medical facilities have their own capability assessment report. But what this report does, it's very critical because it determines what your medical capabilities are and any restrictions are that the doctor's placed you under. And we tell people, don't leave the doctor's office without it. That's easier said than done. Doctors don't get paid to fill out paperwork. They get paid to see patients, right? And so they're going to tell you, well, I'll fill it out and mail it in. I'll file it online. I'll fax it over. And they may certainly do that, but it might take them 2 or 3 or 4 days to do that. In the meantime, we can't let you go back to work until we have this capability assessment report, because if we don't know what your restrictions are, we don't want to bring you back into the workplace and put you in harm's way to injure yourself even further. So if we're waiting for a doctor to send that form in, now you have to take 2, 3, or 4 days of vacation or sick leave waiting for this doctor's report of injury to come in. And we feel that you can utilize your time better than taking vacation or sick leave waiting for a doctor's report, and you can utilize that time way better in other ways. So if you don't get this doctor's report of injury, tell your supervisor and your risk manager. I guarantee if your risk manager knows you're going to the doctor's office, they're going to be asking you for this. If you don't get it, let them know. And between your risk manager and Jennifer Mormon, our internal claims manager, we pretty much guarantee they'll get it for you the same day. It's that important to us, and it's that important to you, because we don't want you to have to use those vacation and sick days waiting for that report to come in. And so we will work off of that form to determine a return to work plan and option for you. Okay, and we need this form every single time you go to the doctor, because your restrictions may change, right? You might have started with a 30-pound lifting restriction, and after 2 weeks, now that's down to 15 pounds. We need to know that so that we can adjust your work schedule to accommodate those work restrictions the doctor's placed on you. And you need to follow these restrictions 24 hours a day, 7 days a week. A lot of people think, oh, I was injured at work and I just have to follow the restrictions when I'm at work, and when I'm away from work on the weekend, I can do anything I want. And that's not the case. If a doctor's placed a 25-pound lifting restriction on you for the next 2 weeks, you need to follow that every single day of the week until those restrictions are lifted. Because if you don't and you go home and you lift something 25 pounds or more and you re-injure yourself or aggravate that injury, that's the basis for workers' comp to deny further payment of your injury. So that's why it's critical that you know and understand what those restrictions are. If you don't know what those restrictions are, or understand them, talk to your risk manager. Jennifer will assist in that process to make sure everybody's on the same page when it comes to following those restrictions. We'll talk a little bit about our claims management return to work program. The county employer group probably has the most comprehensive transitional return to work program in the state of North Dakota. It's been a very, very successful program. It's a program where people get injured maybe a little more severely, and they might be off of work for maybe a week, 2 weeks, 3 weeks, or more, depending upon the nature and severity of that injury. But it's a program that we developed where we bring people back to work as quickly and as safely as possible in predefined work temporary job duties. Okay, we've done our homework in this program. We've developed a big, thick transitional return to work program manual that has literally hundreds of potential transitional jobs that people could come back to that would fall within the restrictions the doctors place them under. And so we work very closely with the doctor. It lends a lot of credibility with the doctor's office because they can look at very detailed job descriptions that talk about standing, sitting, bending, stooping, lifting, temperature extremes you might be exposed to. And the doctor can look at that and say, yes, that employee could work on that job duty based on the restrictions I've placed on them. And so a lot of employers tell doctors that they have return to work programs. You know what their return to work programs are? Hey, get back to work. We need you. Okay, and they're not concerned about the safety and well-being of their employees and putting them in harm's way, bringing them back to work where they may exceed the restrictions the doctors placed you under. Doctors will be the first people to tell you that work is therapy. Doing something is better than not doing anything at all. And that's why we try to bring you back into the workplace as quickly and safely as possible. And we do this by focusing on people's capabilities rather than their disabilities. I think far too often people focus on what people can't do rather than what they can do. And that's what we focus on, what people can do. And we always start within your own department. So depending upon the injury and the department that the employee works on is the first basis to a transitional return to work program. If you work in the auditor's office or treasurer's office or recorder's office and you're working in an office setting and you break your ankle falling down the steps, you're more than likely going to be able to continue to do 100% of your duties, right? We might have to make some different accommodations for you to accomplish that, but you'll stay in your work setting. But if you're in the road department or maybe a social service employee that makes house calls, maybe you're a law enforcement personnel who drives a vehicle and you're injured to an extent that you can't do that, or that road department can't drive a road grader, first of all, we're going to look within your own department. Is there something you can do within your own department that meet the restrictions the doctor's placed on you? So in the road department, if they can't drive a road grader, can you work in the shop and do some light duty in the shop? If so, then we do that until you can transition back to your regular job. If you couldn't do light duty shop work, then we have to find something else in another department during that transitional return to work program. And we work very closely with the supervisor, the employee, the risk manager, and the department that the employee is going to make sure that it's a meaningful job and it's a job people are capable of. Right? We don't want to give people meaningless jobs or jobs they can't accomplish. So if you have a road department employee that never works on a computer in their job, the last thing we're going to do is throw them in the auditor's office and do data entry all day, right? It doesn't work for the auditor's office. It doesn't work for the employee. So that's why we work very closely with the employee to find a meaningful return to work job. And a lot of times people say, well, why are you rushing me back to work? I got hurt at work. Shouldn't I be at home resting? And as I said, doctors will say work is therapy, right? So we want you to be doing something. And there is a great benefit. And it's one of the biggest reasons we developed this program was to benefit employees. And the benefit to you as an employee, if you're injured to an extent where you'd have to use the transitional return to work program, is that the last thing we want to have you do is go on workers' comp disability benefits. Because if you go on workers' comp disability benefits, they only pay 66 and 2/3% of your wage. So now, because of a legitimate workplace accident that was maybe no fault of your own, you're taking a 1/3 pay cut in your salary. And that causes financial hardships for people. And that's definitely what we want to avoid. So we bring you back into this transitional return to work program. And no matter what job you come back to, you continue to earn 100% of your salary. And so that's the benefit to the employee. And we don't have those gaps of decreased income for employees. Plus, workers' comp has a benefit cap. So no matter how much money you make in salary, they have a benefit cap, and they're only going to pay that benefit cap in disability benefits. And most all county employees make enough money in salary that they're also affected by this benefit cap. And so we saw employees losing 40, 50% of their salary because they were affected by a workers' comp benefit cap. And so that's the main benefit for the employee in this program, is that you're allowed to come back to work in some capacity that's safe for you, and you continue to earn 100% of your salary. Personally, we hope you never have to use this program, because if you do, it means you've been injured at work. And that's our number one priority, is to keep people safe and injury free. But if you are injured, then it's good for you to know that we've got a program set up to assist you through that return to work process. One other benefit of this program is it's virtually eliminated fraud in county government when it comes to workers' compensation insurance. Okay, gone are the days that somebody would fake a back injury, because there's no x-ray in the world that can tell someone if your back is sore. You fake a back injury and you're looking for 2 weeks off of work, and you'll take that reduced benefit for a couple weeks because you just don't have to work. But this program has virtually eliminated that, because now if you're in a hospital bed, that's about the only way you wouldn't be coming back to work. And so we're going to make sure that we assist you through that process. We'll talk just a little bit about our drug-free workplace. Unfortunately, we can't ignore stuff like this in county government. We do have drug and alcohol issues in county government, just like every other employer in the state of North Dakota. So we'll talk about a few things associated with that. First, our EAP programs, our employee assistance programs. We either have formal or informal EAP programs in each county. Make sure you check with your county risk manager or the auditor to see which one you have. A formal means that the county contracts for services with an EAP professional, and it's a paid benefit for that employee or those employees. An informal mean that the county still has to contract for services with an EAP provider, but it's not a paid benefit by the county. So you'd have to use your personal insurance or some other means to pay for those services. It's a 100% confidential program, and it's not always for drug and alcohol use. It can be for home issues, family life issues, whatever issues people have. Even though the county contracts with an EAP provider, they don't get any information on who used the program. At a minimum, they might get a report that says 3 people used it, but they don't even get a report for what those services were. So it's a very confidential. All the information about your EAP program needs to be posted on every bulletin board in the county where county employees work out of. So any building that they work out of at the main bulletin board, that information should be provided, because after all, it is confidential, and we don't want people having to go somewhere asking who their EAP provider is and how they contact them, because now all of a sudden it's not confidential anymore, right? So that's why it's posted on your bulletin boards. If you can't find it, again, ask your risk manager or your auditor to make sure that that gets posted on the bulletin boards. Drug and alcohol testing policies, these are 4 things that we highly recommend for counties to have in their drug and alcohol testing policy. Some counties are very good at having all of these. Some counties aren't, right? It's like we work with 53 different employers, right? And trying to get everybody on the same page with drug and alcohol testing policies. But we're moving forward in this. We've made a lot of progress over the years in getting more and more of these steps included in drug and alcohol testing policies. Starting off with pre-employment. Pre-employment is probably one of the most important things a county could do, is have pre-employment drug and alcohol testing, because what that does, it protects all the good employees that are already working in the county, right? We're preventing people from coming into the county with drug and alcohol issues. And we see this so many times over and over again, where counties tell us, yeah, we were going to hire this person. We told them the last thing they had to do was go take their drug and alcohol screening. And guess what happened? They never showed up. They never came back. Okay. It's bad because the county lost a potential employee to fill a position, right? But it was great because we prevented that employee with maybe a drug or alcohol issue coming into our county and posing a threat to our employees. Post-accident or incident testing is very critical, especially in moving vehicle violations and anybody that's in a safety sensitive position. Some counties haven't had a post-accident testing policy, had a serious injury or an accident, and thankfully, because the highway patrol, the sheriff's department was there, city police maybe, under their suspicion, they ordered a drug and alcohol screening, a blood test. And that saved that county from having a claim accepted that might have gone undetected as a drug and alcohol abuse claim. Because if we can detect that somebody's under the influence of drugs or alcohol, then workforce safety and insurance will deny that claim. And usually those claims come with very high costs. And so we want to have a post-accident testing for anybody driving vehicles in safety sensitive positions. And it's benefited many, many counties over the years because we've able to prove that somebody's under the influence of drugs or alcohol. Some counties do random testing for all employees, and some counties do random testing for employees who are in safety sensitive positions. The county has to define what is a safety sensitive position. This is always a good policy too, to have in place. Our road department employees, they're randomly tested, but that's not a county mandate. That's a federal mandate that has to be followed for random testing for that. The minimum any county could ever have in their policy is reasonable suspicion. And we want to have that in there, and they have to have that in there. And any supervisor, department head could ask for a reasonable suspicion drug or alcohol testing if they suspect that somebody's under the influence of drugs or alcohol. Maybe it's because of an employee's appearance or speech, their behavior. We need to document those circumstances up to the point where you would go for reasonable drug or alcohol screening, but maybe sometimes you have to do it right then and there, right? Maybe an incident occurs today that you haven't had time to document, but you said, okay, we need to maybe think about drug or alcohol screening. Okay, so something could be immediate. Some counties have utilized their sheriff's department for alcohol testing. More and more counties have started to use that, and it's a great free resource for counties to use. And so if you have a reasonable suspicion incident, you can use your sheriff's department for the alcohol testing on there. And one thing with our post-accident testing with moving vehicle violations, a lot of times counties ask us, well, at what extent and how severe does the accident have to be before we drug and alcohol screen? And we tell them there is no threshold, right? Anything that seems minimal even needs to be drug and alcohol screened. We had a situation in a county where somebody was backing out of their parking spot at the courthouse and backed into a post. Okay, now this doesn't matter if you're driving your own personal vehicle or a county vehicle for post-accident testing. And so the employee reported that they backed into this post, and the risk manager called and said, well, there's just a little scratch on the bumper. The employee didn't get hurt. Do we still need to drug and alcohol screen? And the answer to that was absolutely yes, because what if that person is under the influence of drugs or alcohol and we let them leave, and 10 minutes later they're in a head-on collision on a county road or city street somewhere, and now we've got a serious injury accident situation with a county resident, a family, and now the county faces a much bigger liability issue if that should happen. So we don't have any thresholds on post-accident testing, or if there's a serious incident as well, because we could have a car accident, right, where nobody needs to go see a doctor, but we still need to drug and alcohol screen for that. We're going to talk just for a couple minutes about opioids in the workplace. About 3 or 4 years ago, we really covered this heavily in our drug-free workplace training program. Unfortunately, 3 or 4 years later, we're still in the same boat. And you can read some of these statistics on here that are really alarming, that these continue to happen over and over and over again. And in 2020 in North Dakota, we had 115 drug overdose deaths. And those are reportedly up from 2021 because maybe all the data is not in, but there's reports that already show that we had 131 overdose deaths in 2021. So it is still a problem, not only in America, but it's a problem in North Dakota as well. In 2020, out of 100 prescriptions written, 36.7 of those were written for opioids. Okay, so over 2/3 or over 1/3 of every 100 prescriptions were written for opioid use. And when people go in for an injury and doctors are going to prescribe medication, your first question to that doctor is, are there different alternatives other than opioids? Are there non-addictive alternatives for medication that I can take? And the answer to that is simple. It's yes. All you have to do is ask. If you don't ask, there's a high likelihood that the doctor is going to prescribe an opioid medication to you. And the thing you have to keep in mind too is opioids don't heal the condition. They only mask the pain. They're not doing anything to improve that injury that you sustain. They're only masking that pain. And the longer you take that opioid, then it discontinues to mask that pain as well as it did in the beginning. And that's when people start taking more than their prescribed dose. And then maybe all of a sudden their prescription ends and they're still in pain and they're looking for relief. And that's when they can go out and look for opioids in other areas too as well. So opioids can impair the thinking and reaction time, and that can be a serious situation on a job site, right? Because it's putting coworkers at risk. As well. It's not always the person under the influence of drugs or alcohol that get injured. A lot of times it's our coworkers that are getting injured because of the carelessness of that person under the influence of drugs or alcohol. It's kind of like drunk driving accidents. The drunk driver doesn't always get hurt the worst in those accidents. A lot of times it's the victims in the other vehicle that get hurt the worst from that. So we have to keep an eye on those and the risk that it puts people in when they come to the workplace under the influence of opioids. So we have to look for signs of misuse. People start not fulfilling their responsibilities in life, in school, work, those type of things. They just act different. They withdraw from important relationships or activities. They're going to multiple sources now to get their opioids. Maybe their prescription ran out, so now they're going to friends to get them. They're stealing them, or they turn to heroin, which is much cheaper solution when they can't get their prescribed opioids. And then people turn to heroin, and that's when a lot of the overdoses occur. And it never fails. After every year of doing these training sessions, somebody contacts me and tells me of somebody they knew, either a friend or a relative, that died of opioid use. And I think we all know them. A lot of people have known people throughout the course of our time. So I always ask the question, what would you do if you knew somebody had a drug or alcohol problem in the workplace, or a friend of yours? Would we ignore it? Would we report it? I think a lot of people have a tendency to ignore it because they don't want to get involved. But people are friends with each other in county government. And if that's your friend and they're struggling and have issues, shouldn't we do whatever we can to help that person? I know people don't like to get involved, But we're not doing it to get people in trouble. We're doing it to help people. So anything that we can do to help people is the right thing to do, and we really need to consider that if we know of situations of drug or alcohol usage in the workplace. We shouldn't ignore that. So you can get help in many different places, or you can direct people to get help, starting with your employee assistance program, using that. If you have a problem and you think you're developing a problem, let your doctor know. They're going to change your medication plan, and they need to do that for you. Maybe you've been injured away from work. We've had a couple situations over the years where people have been injured away from work and they were prescribed opioids and they kept coming to work because maybe the employer didn't know the doctor prescribed them opioids. But we've had people come forward and say, I drive a road grader and I'm taking hydrocodone or Oxycontin, and it really affects my ability to drive this heavy piece of machinery. We really want people coming forth to do that. You shouldn't be embarrassed to tell us that, because we'd rather find a transitional job for you, even though it wasn't a work-related injury, and keep you out of that heavy road grader for maybe a week or 2 weeks, than it is to risk you being in an accident and hurting yourself or hurting someone else. So even if you were hurt away from work and you want to come and tell us that you're taking opioids and it's affecting your ability to perform your job duties, that's the best thing you could do for not only yourself but your coworkers as well. And then there's hotlines that you can call. There's a number on the screen you can call for treatment options. And please know that we're always available too. Sometimes people know of drug and alcohol issues in their counties and they don't want to get involved, or they think they'll get in trouble, or they brought it forward and nobody's done anything about it. We could tell you about a lot of drug and alcohol nightmare issues that we've experienced and seen, and injuries related to those in county government. So come to us. You can come to us anonymously. We'll never divulge your information, and just know that you have us at the CEG as a resource for that as well. So with that, that's our training for today. We have some contact information on the screen. You can always contact us here at the County Employer Group. We're always willing to help in any way. If it's claims related, safety related, drug and alcohol related, whatever the situation is, please know we're here to help. We have risk managers in every single county location, and some of our law enforcement facilities. And those risk managers have been trained extensively in our program, and they know exactly what to do. And if they need assistance from us, they come to us and we assist in that process too. So know that you have a resource for us as well to come with any issues that arise in the workplace. So with that, thank you very much for attending the training today. We appreciate your time and your attention. You'll get a survey potentially after this, a follow-up email. If you have any questions, comments, or concerns, please let us know. We like good or bad, whatever you think of our training, so that we can improve things. And when it comes down to it, we're here to help and make sure that the claims management process and safety process goes as smoothly and as easily as possible for you. So once again, thank you. Have a great rest of your day or evening, and remember to work safe and work smart. Thank you.